The Breast is Best campaign began in 1978 when the book Breast is Best was published by Penny and Andrew Stanley. But this was over 40 years ago. We have made so many medical advances since then, so is this information now outdated? Are there better ways to feed babies? And does it truly make a difference in the baby's life if they are breastfed or not? Those are all questions we are going to unpack in today's video. Before we unpack all of these questions, I first want to share about We Heart Nutrition. We Heart Nutrition is an American-owned pro-life third-party tested company supplying quality vitamins for, in quotes, folks who share our values. I recently received my first box of whole life nutrition vitamins in the mail, and let me just say, I was impressed.
I'm impressed.
I received the Wholesome Prenatal Vitamin and the Wholesome Omega-3 in glass bottles, non-toxic, in my box along with the stunning bamboo capsule box. And I have always struggled to take my vitamins since they usually just sit in the cabinet and they're kind of ugly packaged and I forget about them. But now with this bamboo box that I can now place on my counter that is very aesthetically pleasing, I don't forget as easily. Shop all vitamins from women's to preconception to postnatal and pregnancy essentials and more using the link in the description of this video, or use code KATHERINEANNRN for 20% off your entire order. But back to today's topic. Let's unpack breastfeeding and answer the following 4 questions. What is the Breast is Best campaign? What is the Fed is Best movement? Does nursing and pumping accomplish the same goal? And what is best for the baby? First, let's discuss the history of the Breast is Best campaign and why it came into action. So in the 1970s, the knowledge about breastfeeding dropped from generation to generation, not teaching one another, leading to fewer and fewer babies being breastfed. So when I say breastfed throughout this video, I mean nursed. If I'm speaking about pumping, I will state pumping. Some people say pumping is breastfeeding, as technically you kind of are in a way, but for today's purposes for this video, breastfeeding means exclusively nursing and pumping means actually pumping the milk out. So it was reported that 77% of babies born between 1936 and 1940 were breastfed, and come the 1970s, only 25% were breastfed. This could have been due to many reasons though. For example, women going back to work full-time, formula becoming popular in America throughout the 40s and 50s, formula having the stamp of medical approval by many doctors.
Approved.
And the lack of knowledge, again, being passed down generation to generation around breastfeeding. I remember a story I was once told, or I either read it in a book, that a provider in those days told a pregnant mother that only poor people breastfeed their children and she should use formula instead.
No way.
That is mind-boggling. So with all of that being said, the decline of breastfeeding could have had many factors, but the Breast is Best campaign looked to change the culture once again back to educating on the importance of breastfeeding. But in response to the Breast is Best campaign, advocates came forth to then promote the Fed is Best movement. They acknowledged that there are some health benefits in breastfeeding, but stated that a baby who is well nourished is the ultimate goal, regardless on how that baby gets their nourishment. This movement started in the early 2000s and became a nonprofit in 2016. And you could say the Fed is Best movement may have led to the two sides coming together and supporting one another in how they see fit to feed their babies. But I question, has this also caused a negative outcome? Before I can answer that, I first need to answer questions 3 and 4 of today's video. The third question I wanted to unpack, does nursing and pumping accomplish the same goal? This is where I will spend a decent amount of time today. This is the heart of why I am even putting this video out. My goal is always to educate my viewers, and this is very important information that I have recognized many do not know. Let's first talk about pumping and its health benefits for the baby. Compared to formula,
Krabby Patty formula.
breast milk is better absorbed and used by a baby. baby. Mother's milk babies also have a decreased risk for asthma and skin problems related to allergies compared to formula-fed babies, who have a higher risk of milk allergies. The formula's mine! Compared to mother's milk can change and disrupt the healthy bacteria in a baby's gut. Good bacteria in the gut helps to aid in digestion and fighting off disease. This is a huge perk to choose to pump versus formula feed. And you can also add to this list that breast milk babies have a lower chance of leukemia, diabetes, and obesity as they age. I do want to state this list is not exhaustive, and there are other benefits I have not and will not discuss in today's video. Pumping milk for a baby to drink via bottle sounds like it has so many benefits, and it does compared to formula. Formula time! But how does it compare to when a baby is nursing from its mother? Are there any health benefits for the baby to drink directly from the mom? Both are getting mama's milk, right? So what is the difference, if any at all? The answer to that is yes, there is a difference. One thing that happens during nursing that does not happen if you are pumping is the adaptability of your milk supply for your baby. In quotes from the CDC, your baby's saliva transfers chemicals to a mother's body that causes breast milk to adjust to meet the changing needs of your baby as they grow. This is an absolutely amazing design by our creator. It was also reported that babies who are breastfed usually go to the doctor for sick visits less often, need to take fewer prescription medications, and are less likely to go to the hospital. And this makes sense, as what we just discussed of how baby saliva tells a mama what to produce in order to help the baby grow and develop. And not only is nursing different from pumping in this way, but nursing also helps to develop a baby's jaw, something that does not happen when bottle feeding. In quotes from Russell and Bode Dentistry, breastfeeding promotes the growth of a newborn's jaw. Babies must use their tongue to press against their palate, which is soft like wax. This movement helps to expand the palate and upper jaw, which creates straight, wide upper teeth. After hearing all of this information, what do you think is best for a baby? I would 100% stand behind my statement. Nursing your baby is best.
Absolutely.
However, understand that it is not feasible for everyone, as we are all in different circumstances. And as a registered nurse, I cannot sit here and tell you what to do, but I can educate you about this topic. I personally had a challenging nursing journey with my daughter for the first 10 weeks. It was brutal, but now I am 15 months postpartum and have exclusively breastfed thus far.
I'm a cool mom.
Before I gave birth, I took an incredibly helpful breastfeeding course by Dr. Robyn Thompson called Breastfeeding, the Thompson method. And I would highly encourage you, if you are expecting or if you are thinking about giving up on breastfeeding, to look into taking this course. Dr. Robyn Thompson's approach is evidence-based, grounded in an anatomical understanding of the breastfeeding mother and baby, and highlights a gentle approach to breastfeeding contrary to what is commonly taught in hospitals. Now, I am not affiliated with this company, but I will, however, put the link in the description of this video for Dr. Robyn Thompson's course. All in all, the Breast is Best campaign had really great intentions, as did the Fed is Best movement. And what I think has been lacking in regards to education is the fact that pumping is not the same as nursing, and there are significant health benefits that are not discussed when you exclusively breastfeed versus exclusively pump. What has your experience been around this issue? Did you nurse and have a great experience? Was it hard like mine? Were you not able to nurse? Comment down below. I would love to hear from you, as I'm sure other mamas out there would love to hear your story too. Thank you all for watching, and please make sure to subscribe to my channel for more holistic health and living videos coming out weekly. And make sure to go check out my Amazon storefront, where you can learn more on how to lead and live a holistic lifestyle. Thanks for watching, everyone, and I'll see you in next week's video. See ya.